What is myofunctional therapy? So this has been around for a little while, but it's actually something that not a lot of people are familiar with. And what myofunctional therapy does is it treats the underlying dysfunction of chewing, swallowing, and breathing. Myofunctional therapists assess for what is called orofacial myofunctional disorders. Some examples of that could be low resting tongue posture, mouth breathing, malocclusions such as an anterior open bite, tongue scalloping, and many more. And myofunctional therapy can help reduce and eliminate a lot of those orofacial myofunctional disorders to kind of improve the client's overall quality of life. So what are the goals of myofunctional therapy? Well, we want to eliminate or minimize any unnecessary activities, which we call parafunctional activities. So excessive gum chewing, nail biting, anything that you're chewing on that's extra, that's not food, is considered a parafunctional activity and can contribute to an orofacial myofunctional disorder, particularly TMJ issues. Another thing we want to do is establish lip competency. We need to be able to keep our lips sealed at all times, of course, unless we're eating or drinking or speaking, so that we're optimally nasal breathing, which is another one of the goals, is trying to focus on nasal breathing and eliminating all mouth breathing. We also want to focus on good head and neck posture to eliminate any of those forward head slouching positions. And additionally, one of the more important ones is keeping your tongue up to the roof of the mouth. Maybe you've heard that before. The trick is how much of your tongue is really getting up there. Most people are only getting the front half of their tongue, but really we need to be getting the back part of the tongue up there as well. Lastly, we also want to work on toning some of the muscles of the tongue, around the jaw, and as well in the back of the throat and soft palate where the oropharyngeal muscles are. When those muscles are elevated and working properly, we have good airway flow and we don't struggle and mouth breathe. Now, as far as myofunctional therapy goes, it's a long-term therapy. It takes quite a while to develop these new patterns. You might think, oh, but I can put my tongue up there all the time. But what about when you're not really focused on it? I would challenge you to check in with your mouth a couple times a day when you're doing something different than just sitting. You know, if you happen to be vacuuming or working in the yard, what is your mouth doing? Is it open? Are you breathing through your mouth? Or is your tongue elevated to the roof of your mouth and your lips are sealed and you're nasal breathing? You'd be surprised. It's a little harder to do than you would expect. But the type of therapy this is, we're trying to create what's called neuroplastic change, and that's really changing the physiology of your brain and how it behaves with new patterns and new movements. When you learned how to ride a bike, it probably was a little difficult as a kid, but because you did it over and over again, and you've been doing it for many years of your life, it becomes pretty easy. So same with myofunctional therapy. It takes some time to learn how to do these new movements and to establish more of its subconscious habit, but you can get there. If you enjoyed this video, thank you for watching. Like the video and share it with someone if you know someone that would benefit from myofunctional therapy, and go ahead and hit the subscribe button if you want to follow along for more.